Hello everyone, I'm Dr. Akshay Hari, consultant neurosurgeon and spine surgeon working at Aster CMI Hospital, Hebbal, Bangalore. Today I'm going to be talking about scoliosis in children, how to deal with it, how to identify it, how to live with it, and how to manage it in our daily lives. So scoliosis is an abnormal curvature that develops in the spine. Usually it affects people of all age groups, but children are the most commonly affected subgroup. While most scoliosis may be mild to moderate, especially in children, it is very essential to detect these scoliosis early because early intervention and treatment is the key to successful outcomes. So why does early detection of scoliosis matter? First of all, we must all remember that scoliosis is a progressive condition. Scoliosis, especially in the earlier ages of children, will progress as the child grows into adulthood. So therefore, it is very important to detect this kind of scoliosis, especially in the earlier age groups, so that appropriate intervention may be initiated at the right time and prevent complications in the future. So what are the reasons why early detection is crucial? Number one, children, especially in the earlier age groups, have a large growth potential. So curves which are detected earlier in the age groups do tend to progress as the child grows older. So if they are detected in the earlier age group and proper treatment is initiated at the right time, these curves can be prevented from progressing into larger ones. Number two, the treatment options. So the treatment options vary if the curve is small as compared to a curve which is larger. Smaller curves, for instance, can be managed with methods such as bracing. For instance, bracing can be applied in smaller curves, especially in growing children where the spine is still flexible. And in these cases, progression of the curves can be arrested and prevented from becoming larger. The third reason why early detection is important is because of improved outcomes. What we must know is that smaller curves, if the treatment is initiated at the right time, have better outcomes as compared to larger curves where the treatment may be more invasive and the recovery time may also be longer. The last reason is the reduced risk of complications. We must remember that if left untreated, scoliosis can progress and smaller curves can become larger curves and very severe curves. Now these curves have a greater risk of complications such as breathing difficulty, and as larger curves can compromise the lungs as well as the heart, and sometimes this may also lead to neurological deficits. So it is very important that if detected early, these curves can be treated at an initial stage itself and can be prevented from progressing into larger curves which can have greater risk of complications. So if you have identified scoliosis in your child and it has been detected early, the next step would be to consult a spine specialist who can then guide you and initiate early intervention strategies. One of the strategies would be monitoring. If the scoliosis is a mild degree, the simplest management would just be to observe. There would be no further treatment required at all. Sometimes bracing may be initiated as one of the treatment modalities, especially in moderate curves around 20 to 30 degrees. The next stage would also be involving a combination of physiotherapy methods as well as exercises to strengthen the spine. Lastly, surgery may also be required if at all the curves are very large. At this point, I would like to highlight certain misconceptions regarding living with scoliosis. First of all, most parents think that bad posture is responsible for scoliosis and its progression. Actually, the contrary is the truth. It is the scoliosis that is responsible for the bad posture and not the bad posture that is responsible for scoliosis. The second common misconception is about heavy school bags. Most parents think that wearing heavy school bags or carrying a lot of load on the spine may actually contribute to progression of scoliosis or development of scoliosis. While heavy school bags carrying responsible for back pain in general, it does not lead to progression of scoliosis. The third thing is living a normal life with scoliosis. Many people think that the normal life itself will be restricted as soon as scoliosis is detected, or that the children may not be able to play sports, or that they may not be able to lead a normal life. The contrary is actually the truth. Most children with scoliosis, like I mentioned, may not require any major intervention and can absolutely lead a normal, healthy life. The last misconception is that it is too early to treat scoliosis. I've already mentioned that early detection is very important. At the same time, early initiation of treatment is also equally important. It is never too early to initiate treatment for scoliosis. Treatment may range from conservative methods to bracing to sometimes even surgery to prevent the progression of scoliosis. So it is very essential for us to remember that early detection is the key to early intervention and prevention of progression of scoliosis so that the child can lead a normal, healthy life. Thank you.